Dr. Dustin Bechtold performs 3D printed joint replacements at Avera Orthopedics in Sioux Falls. He says research for this type of treatment has ramped up in the past couple years.
In this case, the actual implants are in titanium, but there are resins that are used for modeling and for the preparation used in the surgery.
Dr. Bechtold says older patients have used it for joint replacement, but younger patients use the 3D printing for removing tumors on their bones.
They can be done around shoulders, hips, knees. A lot of the applications are for tumor currently, where if a bone has to be removed because of a tumor and that bone needs to be reconstructed, that's a good application. Or around joint replacements, where there's bone loss and you have to replace that bone.
The process is started with a CAT scan of the impacted bone. It then is sent to a company who creates the mold of the bone needed along with the other parts. It's then given to the surgeon to start the surgery.
The surgeon with that technical team would decide exactly how to position that implant, how you would want the socket part of that pelvic implant, for example, to be oriented, and then fabricated. And that does take quite some time.
Dr. Bechtold says a big advantage of 3D printed joint replacement is the product is specific to that person's bone and can be better than usual methods.
Probably the best advantage is when there's a huge defect or a complicated defect that you can't fill in with normal prosthetic parts.
However, a side effect is the long rest time needed along with digging through the body to reach the bone.
To get that part in there, we forget sometimes that there's a lot of tissue and muscle attachments and other parts that are in the way. So getting access to all of this bone and being able to support that component can be a little bit challenging.
Overall, Dr. Bechtold is hopeful for the future of this technology. But with high costs, along with some surgeons preferring other surgeries, Dr. Bechtold says all we can do is wait to see how it turns out.
There may come a time where that becomes a series of studies might show that people who have a truly customized set of implants placed in a customized fashion might do better. I think in that moment would shift more toward that type of a technology. So far it just hasn't borne out to be better.